Welcome back to Med Madness, where we dive deep into critical medical topics to help you ace your exams and enhance your clinical knowledge. Today we're discussing a significant concern in prenatal care: syphilis in pregnancy. This topic not only holds great importance for medical professionals, but also for ensuring the health and well-being of both mothers and their babies. Let's get started. Screening for syphilis is a crucial part of prenatal care. Every pregnant patient undergoes universal screening at their first prenatal visit. This early detection is vital because it helps us identify infections that can be transmitted from mother to baby. For patients at high risk, those with a prior history of sexually transmitted infections or younger than 25, additional screening is done in the third trimester and at delivery. This high-risk group requires meticulous attention to prevent severe complications. To detect syphilis, we use serologic tests. These are divided into non-troponomal tests like the Rapid Plasma Reagin, RPR, and Venereal Disease Research Laboratory, VDRL tests, and treponemal tests, such as the Fluorescent Treponemal Antibody Absorption, FTA-ABS test. The approach is to use either type initially, but any positive result must be confirmed with a test from the alternate category due to the potential for false positives. Once diagnosed, the treatment of choice is intramuscular penicillin G-benzathine. This remains the gold standard due to its superior efficacy. Pregnant women who are allergic to penicillin typically undergo desensitization to ensure they receive this critical treatment. The importance of this cannot be overstated, as the consequences of untreated syphilis can be devastating for both the mother and the fetus. Syphilis can lead to severe obstetric complications. Intrauterine fetal demise and preterm labor are among the most concerning outcomes. The infection can significantly disrupt a pregnancy, underscoring the necessity for early detection and treatment. For the fetus, the effects of syphilis are varied and severe. Hepatic complications include hepatomegaly and jaundice. Hematologic issues can manifest as hemolytic anemia and decreased platelet counts. The infection can also cause musculoskeletal abnormalities, particularly in the long bones, and generally result in failure to thrive. Syphilis presents in several stages, each with distinct clinical features. Primary syphilis is marked by a painless genital ulcer known as a chancre. If untreated, the infection progresses to secondary syphilis, characterized by a diffuse rash that often involves the palms and soles, along with lymphadenopathy, oral lesions, and hepatitis. The latent stage of syphilis is asymptomatic, but can lead to tertiary syphilis if not addressed, causing severe complications such as central nervous system involvement, cardiovascular issues like aortic aneurysm or insufficiency, and tumor-like lesions on the skin and internal organs. Let's look at a real-life case that highlights the importance of early detection and treatment of syphilis in pregnancy. A 28-year-old woman at 31 weeks gestation presented with a maculopapular rash covering her trunk, extremities, and soles. This presentation is classic for secondary syphilis. Upon further examination, it was noted that her fundal height was lagging, measuring 28 centimeters, a possible indicator of fetal growth restriction. This patient had missed her initial prenatal visit and had limited prenatal care, placing her in the high-risk category. Screening revealed a positive RPR test, which was confirmed by an FTA-ABS test. She was promptly treated with intramuscular penicillin G-benzathine. This timely intervention not only helped address her syphilis, but also potentially prevented more severe outcomes like intrauterine fetal demise. In conclusion, syphilis in pregnancy is a critical issue that requires early detection, thorough screening, and effective treatment. The protocols in place, from universal screening at the first prenatal visit to additional checks for high-risk patients, aim to safeguard both maternal and fetal health. The case study we've discussed underscores the importance of these measures in preventing serious complications. Thank you for joining us on this episode of Med Madness. Stay tuned for more in-depth discussions on essential medical topics. Until next time, stay informed and stay healthy.